Hello, I'm Betsy Ross, and welcome to this edition of Healthline. Did you know that oral cancer is the 6th most commonly diagnosed form of cancer in the United States? We'll talk with Dr. Michael Palmer about this important health issue. We'll also be getting some timely tips on how to keep our food safe when eating and cooking outdoors this summer. That's all next and more on Healthline, presented by the Northern Kentucky Medical Society. Oral cancer. It's one of the few cancers whose survival rate has not improved in the last 50 years. Our first guest today is going to help us understand why we are the most important factor in early detection. Dr. Michael Palmer, thank you for being with us today.
Thanks for having me.
We really don't talk a lot about oral cancer. There are no big fundraisers, no big weeks or months that we set aside. Why is it so important for us to be aware of oral cancer?
Early detection is the most important thing in treating oral cancer. There are approximately 30,000 oral cancer diagnosed every year. And out of those 30,000, the 5-year survival rate is less than 50%. We have an aging population over the age of 50. Those patients, we really haven't seen a change in numbers. But what we are seeing an increase in numbers of patients 25 years and under, that we're seeing a higher incidence of oral cancer.
So what are some of the causes of oral cancer?
The number one cause of oral cancer, and we're speaking about squamous cell carcinoma, 90% of all cancers in the mouth are squamous cell carcinoma, but 75% of those squamous cell carcinomas are caused by tobacco usage, either smoking or dipping.
Some of the other causes?
Alcohol consumption, immunocompromised patients, as well as patients that have human papillomavirus.
So we talk about early detection. What should we, as our own kind of first line of defense, what should we be looking for to give us a sign that there may be a problem in our own mouths?
A sore or lesion in your mouth that doesn't heal after a couple weeks. Lumps or thickening in your cheeks. White or red patches on your gum, or on your tongue, or on the floor of your mouth. A sore throat, something that's caught in your throat, difficulty swallowing, difficulty moving your jaw or tongue from side to side. You could have numbness in your lip or in your tongue, or you could have swelling of the jaw that's caused, in other words, you have a denture that's in your mouth and it just doesn't fit the way it used to.
So anything different, any change that we might notice? And I guess it's just like any other cancer. The earlier you can detect it, the better off it is for the patient.
There's no question that early detection is important. The patients that we're able to treat the best are the ones that have very small lesions. When we have large lesions, there's probably some metastasis, some invasion into other tissues, so just removing the lesion isn't all we have to do.
We talked about some of the warning signs, something that doesn't feel right, but what can we see visually? What are we looking for when we're looking for a possible oral cancer?
Well, you can look in your own mouth, and you're looking for either a red lesion or a white lesion or a combination. And you want to look in areas that have a greater chance of oral cancer. The floor of your mouth. Lift your tongue up and look around. The lateral borders of your tongue. We're looking at this lesion, and this is a picture of the lower molars, and there's a lesion behind the molars, and certainly this is something that anyone is visually going to be able to see in their mouth. However, this is a very later stage squamous cell carcinoma, and certainly early detection was not there. The second picture that we look at is a lot less, it's a lot more subtle. There's a little sore, and this is a view of the side of the tongue. And if you don't have, if you haven't bit the tongue, this is a lesion that certainly if it's not healed within a couple of weeks, is something that definitely needs to be looked at or biopsied. And then the last photo that we look at is another, it's a red and white lesion, another area on the tongue. Again, we're looking at the tongue. This red and white lesion is one that's very suspicious if there's no other reason for them to have that kind of trauma on the side of the tongue.
So we've been talking kind of our own personal self-examination, what we should be looking for. But when we go to the dentist, really the dentist also is there not just to look at our teeth, but to look for things like this that we've just seen to, again, kind of reconfirm or maybe spot for the first time that there might be a problem.
Certainly we've been trained as dentists to examine patients for oral cancer. You should be looking at the tongue. In other words, we should be grasping the tongue, pulling it out, and looking at the sides. We should be palpating underneath the tongue, feeling the head and neck, making sure that there aren't any lumps or bumps that aren't supposed to be there. And every dentist should be doing an oral cancer examination on every recare appointment that you have. And if you're not sure, you can ask him. A lot of times we get busy, we do our oral cancer examination, and we don't tell the patient, hey, by the way, I don't see anything that looks cancerous in your mouth at this point in time.
And there is a new method, a new machine, if you will, that dentists now are using to try to spot oral cancers even maybe before there's anything on the skin, any kind of a lump or a change.
That's true. We've taken some technology from the medical field, and we use a light now called a Velscope, and it emits fluorescing light, and it makes it easier for us to see lesions that may not be visual to the naked eye.
And you've got an example right here, and seems like a pretty simple machine there that you have, really not too threatening to a patient.
Correct. We put glasses on the patient to protect their eyes, and then we view their oral cavity through this light. And if there are lesions in the mouth that have this plastic tissue, it doesn't necessarily have to be cancerous at this point. It can be a precancerous lesion, but it makes it possible for us to see these lesions before they actually ulcerate. And when we look at this photo, it shows the light passing through normal tissue, and the normal tissue with good cells will fluoresce and be a bright color. If you have altered cells, cells that are becoming dysplastic or changing and becoming cancerous, then the light does not shine on that very well, and you get a darker speck on the tissue.
So if we do see some type of an oral cancer, the treatments?
Typically speaking, the first thing that we would do is we would send them to the oral surgeon for a biopsy of the lesion to make sure that it is or isn't cancerous. If it is a cancerous lesion, then typically speaking, we just excise the lesion or take it out, and the patient heals, and that's all they need, especially if it's an early diagnosis.
But if it's not, as you mentioned earlier, it can really affect a patient's health long term if you can't eat, if you can't swallow, if you can't speak clearly.
Correct. If the patient has to have something more than just excision, if they have to be radiated or have chemotherapy, salivary glands are affected, they may be removing a portion of your tongue or a portion of your throat, then we have quality of life issues that are much more difficult. Inability to swallow or chew your food properly, inability to speak. Those kinds of quality of life issues are the things that we're trying to minimize.
Early detection, always the bottom line.
That's right.
Doctor, thank you so much for being with us today.
Thank you for having me.
And we'll be right back with more after this break.
We all take different paths in life. At Central Bank, we understand this. With a comprehensive selection of financial services and expert advice, we'll help you meet all your needs. Whether you're getting your first home, preparing for a growing family, or planning for your children's futures, Central Bank is always there for you. Central Bank, showing you the way.
Practice does make perfect. something she'll understand more and more over time, like how experience matters when choosing a heart program. At St. Elizabeth Medical Center, we've performed over 10,000 open heart surgeries and saved countless lives. Numbers like that add up to something she can understand today, and that is that her dad's back in her life. St. Elizabeth Medical Center, how medicine should be.
Medical Minutes brought to you by Gateway Rehabilitation Hospital at Florence. And now our Medical Minutes. First, some local good news. St. Elizabeth Medical Center was recently named one of America's 50 best hospitals. In fact, they've received that honor for distinguished clinical excellence 5 years in a row. Congratulations, St. Elizabeth Medical Center, for being the only one in the tri-state to receive this prestigious recognition. Next, some news about an annual injection for osteoporosis. Findings recently published in the New England Journal of Medicine reported that researchers found that an annual 15-minute IV of a common osteoporosis drug greatly reduced older women's risk of fractures. Experts are hoping this information will open the door for the FDA to approve single-year injections. The injection could be an alternative for those postmenopausal women who have trouble tolerating the oral medications currently being prescribed. Finally, Botox may be known for helping to eliminate wrinkles, but recently German doctors used it to stop excessive sweat in a healthy 23-year-old woman. Botox stops the release of a chemical messenger and temporarily blocks the nerves that stimulate sweating. The FDA now has approved Botox to treat severe underarm sweating that cannot be managed by topical prescription antiperspirants. That's the Medical Minutes for this edition of Healthline. We'll be right back after this break. Medical Minutes brought to you by Gateway Rehabilitation Hospital at Florence.
Ask Mike Carpenter the secret behind Newport cleaners, and chances are he'd say speed. You see, clothes are brought into a drop-off location, cleaned and pressed at the plant, and returned back for pickup, all within 24 hours. To help keep up with it all, Mike switched his broadband service to Insight Business. Not only does he find it faster and more reliable than DSL, but the Insight local support team stops by frequently. After all,
hey Mike, how you doing?
Their clothes need cleaning too. Insight Business.
Practice does make perfect. Something she'll understand more and more over time, like how experience matters when choosing a heart program. At St. Elizabeth Medical Center, we've performed over 10,000 open heart surgeries and saved countless lives. Numbers like that add up to something she can understand today, and that is that her dad's back in her life. St. Elizabeth Medical Center, how medicine should be.
Well, summer is here, and that means lots of picnics, barbecues, and eating outdoors. And the last thing we want to do is expose our family and friends to a case of food poisoning. Since food-borne illnesses are more common during warm weather, well, we need to take extra precautions during the summer months. Our next guest, John Merkel, is Food Program Manager at the Northern Kentucky Health Department. He's here to help us avoid any problems. John, thank you so much for being with us.
Oh, you're welcome.
And I guess that it starts out with having a clean environment, and we hear so much during cold and flu season to wash your hands, but it applies here as well.
Yes, exactly. Summer food safety, hand washing as well as other times, is probably the single most important thing that you can do in order to prevent the spread of the disease.
And we have some antibacterial soap, but let's say if you're out camping or you're at a picnic grounds where you can't necessarily get to a kitchen or a restroom to wash your hands.
Yeah.
What else can we do to make sure that our hands can be clean?
Well, we would recommend, first of all, that you try to carry some extra water with you so that you can wash your hands with that, and hand washing is what we would prefer that people do. If you don't have any water available, then you can go to a hand sanitizer type of a thing, and that will help.
Or use wipes like this might
You
help.
can do that as well. Yeah, you just want to keep your hands clean as much as possible, and then, like I said, if you need to use the sanitizer, go ahead and do so, but hand washing is the preferred method.
Okay, so let's assume that our hands are clean, so we're going to start fixing our food. Many times you will be grilling out, so that means that you will transport raw food from one place to another. So let's talk about transporting it and keeping it safe.
Yeah, well, one way to transport it and keep it safe is to keep it from contaminating, one product from contaminating another. In other words, to prevent cross-contamination, which can become an issue in summertime. So in the case of these, we've got some chicken here and we've got some ground beef, and you can see that they're held in separate bags, a little Ziploc type of bag. And that's a good way to do it, or in separate sealed containers is fine too.
And when you're cooking it, make sure that you use one utensil for the raw, another one for the cook.
Yes, that's very important. If you use one utensil to put the raw onto, say, a grill, then you want to use a separate utensil to take it off of the grill so that you don't introduce the raw juices from the meat, the raw meat, onto the cooked product.
Okay, so let's say that we're transporting it. It's important to keep the temperature right, too, to make sure that we can eliminate any kind of bacteria.
Exactly, yes. So in order to keep the temperature right, you want to make sure that the food is kept, well, first of all, you want to make sure that anything that is a potentially hazardous item, which is things like meat or dairy products, egg products, that they're kept out of what we refer to as the danger zone. And the danger zone is from a temperature range from about 40 degrees Fahrenheit to 140 degrees Fahrenheit. In that zone, bacteria can grow and pathogens can proliferate and create illness. So in order to keep that from happening, you want to make sure that you keep the foods at the proper temperatures, either below 41 degrees Fahrenheit or above 140 degrees Fahrenheit. And you can do that just by keeping it in a well-stocked cooler with plenty of ice and use it that way.
Or you've got some other cooling gels, things like that, that you can use.
Yeah. Yeah, the ice works great, but if you want to use the gel packs and keep plenty of those in there, they will work well as well.
Okay, so you're transporting it in ice in some kind of gel pack. You have this raw food there, but again, you have to keep it separate from the rest of, like, your mashed potatoes or baked beans or whatever else. How do you recommend that people carry it so that it's still safe and it stays away from your other food?
Well, you can do it in a couple of different ways. Like we mentioned before, you can keep it in separate containers if you keep it in one cooler, but make sure that those containers are well sealed. Or you can use a separate cooler, such as this, and just put the raw product in here and keep it in there again with plenty of ice and hold it in there, and then it's going to be kept separate from the product that's ready to eat.
And an inexpensive cooler like this, you can throw it away if it gets contaminated.
Right, exactly. If the meat juice gets on the inside of this, it can then be just simply discarded, since this is probably might cost maybe $1 or $2, and you're not going to lose a lot of money. And it might be hard to keep clean, so you can just go ahead and discard it.
Okay. So we talk a lot about our meats being contaminants, but, you know, we don't always think about our fruits and vegetables also being contaminants, too.
Right. They could be contaminated, and the primary thing to do on those is just to make sure that you wash them good prior to eating. But you also want to keep them separated from the meat. And the way to do that, again, is to keep them in sealed containers separate from each other.
And throw it in the other cooler so you don't have to worry about it.
Right,
A couple of other tips to make sure that our food is safe. We have smaller containers here. If you take, like, a lot of potato salad, doesn't mean it has to be in one big bowl. You can separate it a little bit.
Right, exactly. If you have the food separated into separate containers, then you can pull what you need to use out, and it will be used rather quickly. But what you keep in the refrigerator or in the cooler will then stay cool until you're ready to use it. So you don't have a large amount of product that's going to possibly move into the danger zone and stay there for a while if it's not consumed rapidly.
And you mentioned the danger zone. To make sure that we have the right temperature, just get an inexpensive thermometer, throw it in the cooler.
Yeah, you can do that. You can. It's not a bad idea to carry a thermometer with you and have it in the cooler or refrigerator or whatever that you're using the food out of, and just making sure that the food is not in that danger zone for any length of time.
Great. John, some great tips to keep us safe and healthy this summer. Thank you so much for being with us. By the way, next month we will be learning all about the programs and services available at the Northern Kentucky Health Department. Thanks so much for being with us, John.
You're welcome.
And we'll be right back with House Calls after this break.
In regards to broadband, lightning fast is out.
Lightning travels at 93,000 miles per second.
We're fast, but legally not that fast.
Legal came in with some things that we could and could not say about Broadband 10.0.
Fastester?
Not a word
Now what you can say is...
Speeds up to 10 meg per second.
Check.
Fastest to the home.
Check.
Faster than a lawyer chasing an ambulance? Check.
Would you like to double, triple, or even quadruple your income and eliminate your credit card debt?
I make $5,000 a month of residual income.
Income is at a six-figure income. We'll be making over $8,000 a month this month.
Our first month we made over $3,000 right out of the gate.
Thousands of people are getting started by requesting a free DVD that shows them the way to financial freedom. Like Trina, a soccer mom who started her home-based business part-time and with the help of a mentor made $30,000 the first year and $130,000 the next. Or Brandy, who has now become financially secure and is living the American dream.
The free DVD really opened my eyes.
We made over $18,000 last month.
And there's no experience necessary. Our DVD shows how a mentor works with you to assure your success.
Go to 92getmoney.com and get started today. And respond now while this is still a free service. Go to 92getmoney.com. That's 92getmoney.com. 92getmoney.com.
We all take different paths in life. At Central Bank, we understand this. With a comprehensive selection of financial services and expert advice to meet all your needs, Central Bank is there to guide you down your path in life, wherever it may take you. Central Bank, showing you the way.
Our House Calls segment gives you, the viewer, an opportunity to ask questions about your own medical concerns. And we have doctors from the Northern Kentucky Medical Society ready to answer your questions. Now, our first question comes from Ernie in Bellevue. My son has started smoking, and I want to try to convince him that smoking is not a good decision. What can I tell him about the effects it will have on his health now and as he grows older? Well, we asked Dr. Neil Moser to answer the question.
Ernie, it is tragic that your son has started smoking at age 18. It's very difficult to get children, particularly younger than 25, and convince them of their own mortality and why it is not a good idea to start smoking. Right now, his incidence and his propensity towards things like asthma and cough and bronchitis is much, much higher than his colleagues who do not smoke. I would convince him and continue to work with him towards all the other diseases that occur down the line: emphysema, cancers, heart disease, hypertension, bladder cancers, for example, all of which have the deleterious effect on your health. Work with your son, continue to convince him, and someone as influential as yourself, as well as his peers. Smoking is definitely an addiction. It needs to be treated as an addiction to nicotine.
Dr. John Larkin answers this question from Marie in Newport. All of my 9 grandchildren are very active in different kinds of sports: baseball, soccer, tennis, basketball, and football. Between practices and games, they spend a lot of time with these physical activities. I'm worried that they might be damaging their bodies since they are still growing. Should I be concerned?
Marie, I think that's a very good question. I think in this day and time, our kids tend to be overscheduled. And it's especially common where kids are playing year-round sports. For example, especially club sports where they really don't have a break. And during the off-season, they're conditioning and usually playing the same sport, oftentimes like in an indoor environment. This really represents a real concern in growing children. The biggest problem that we're dealing with here is that as children grow, their muscles and their tendons really are not keeping up with the amount of stress that they're experiencing with all year-round sports. So it is something that does need to be addressed. For example, in a typical sporting activity where you have a tournament where they're playing 3 days a week, they need about 2 days to recover from that the next week. And in sports where they're participating on a weekly basis, they need a participation where they have a day on and a day off for recovery. This is especially true for kids under 10.
And our final question comes from Fred in Alexandria. My wife found that I have an irregular-shaped mole on my back that she wants me to get checked out by a doctor because she's concerned it might be skin cancer like melanoma. But I don't think it's necessary since this area has never been exposed to the sun. Should I have a dermatologist look at it? We went to Dr. Scott Neltner for this answer.
Well, Fred, the simple answer to your question is absolutely yes, that any time you have any kind of pigmented growth on the body about which you're concerned for whatever reason, it's always sensible to have that evaluated by a professional and in particular a dermatologist. The things that we are concerned about as dermatologists as we evaluate pigmented lesions, there are certain criteria that we call the ABCDs of moles, and these are the warning signs that there may be a problem with the mole. A stands for asymmetry, so if one half of the mole doesn't look like the other half. B stands for border notching or scalloping. C stands for color variegation, so if the color is not uniform but shows several different shades throughout, from say like red to black to brown or tan, then that's worrisome. And lastly, if the diameter is greater than 6 millimeters or about the size of a pencil eraser. We would add to the ABCDs also E, which stands for evolving. So if a mole is changing in any way, that certainly warrants further investigation. So because it has been in an area that was relatively sun protected does not mean that it's an innocent mole and absolutely should be evaluated.
Thank you, Doctor, and thanks to Dr. Neil Moser, Dr. John Larkin, and Dr. Scott Neltner for their professional medical advice. Well, we've come to the end of this month's program. We would like to thank all our guests for sharing their expertise about these important medical issues that we've talked about. And if you've missed some of the information listed on today's program, or if you have a question that you would like answered in our House Calls segment, well, be sure to go to the Northern Kentucky Medical Society website and just click on the Healthline button. All of our program information is listed there. You can email us your questions. Each of our Healthline programs will air several times each month, so make sure you check the listings for the days and the times it's on. And we hope you'll join us again next month, where we will learn more about the services and the programs available at the Northern Kentucky Health Department. Goodbye for now. I'm Betsy Ross, and this has been Healthline, presented by the Northern Kentucky Medical Society.
Education is our #1 issue.
John Dowd, the host of Education Issues on ICN6, ends each show with those words. It's because the success of our students determines how bright our future will be. Each week, John focuses on the schools, students, and education professionals of Northern Kentucky. Join John Dowd each week for a new discussion. Education Issues, weekly on ICN6.
Hi, I'm Chef Tony, and now there's a knife so sharp you can cut a pineapple in midair. It's the Miracle Blade 3 Perfection Series. This is my all-purpose slicer, the ultimate in slicing knives. You'll also get Rock and Chop, rips through ribs. Plus, you'll receive my fillet and boning knife. Fillet fish right down to the skin. And my Chop and Scoop. Chop parsley and fresh herbs in seconds. Watch, flex, and scoop right to your favorite recipe. And you get my paring knife. Curve to peel fruits and veggies. I'll also send you 4 steak knives. Call now and you'll get my Perfection Shears and a second Miracle Blade slicer absolutely free.
But wait, we'll send you a second complete set of knives free. Just imagine, that's now nearly $500 worth of knives for just one payment of only $39.95. And if you don't think the Miracle Blades are the best knives you've ever used, just return them for a full refund. So call now.